Texas Children's one of the top-rated children's hospitals in the country. We are focused on education research and clinical outcomes, not just in Texas, but globally. So the Texas Children's data journey is an interesting one. When I started here 13 years ago, we didn't have an electronic medical record, so we didn't have access to data. It was whatever someone was keeping on a spreadsheet. Now we have data at our fingertips, and our challenge is how do we get it to the frontline clinicians fast enough?
There's definitely been a shift in healthcare and how we view data. So you have to balance data security, data governance with data advocacy and ensuring that people have what they need to make the decisions that will improve care for their patients.
One of the biggest challenges to unleashing data is to really convert it into information. Data alone, series of numbers, doesn't really help us with anything. What we have to understand is how that data relates to our processes and how we can translate it into a meaningful way infused with the best clinical and scientific data that then can help us understand what is the next best step.
So our executives understand the importance and the need of data, and we've enabled and educated our users on not only what's available, but what can be available. We have over 200 dashboards today that provides tremendous value to everyone across the organization. The success of the rollout of data and data literacy here at Texas Children's is really great because it means that everyone is making decisions not on a whim, but they understand that there's data behind a decision that they're making.
We have implemented a front door for data solution at Texas Children's Hospital. Part of that front door for data includes education around data tools and platforms that are available. Nearly 20% of our organization is routinely accessing our data platforms on a daily basis.
I am so proud of the team that we developed at Texas Children's and the partnerships that we have between the IT team, the quality team, the safety team, and the frontline clinicians. We're pretty far in our journey on using data, and of course, you're never where you want to be. But if I were going to give some coaching to an organization that's earlier in the journey, I would say identify your partners up front. Realize that IT is there to enable the platforms and the tools, but the clinical team has to be a part of developing the priorities and the strategies of putting that in place. And I would also say be bold. Go ahead, go out there, try it, look at your data, see what it's telling you, and then follow through and really make it about the patient.